All right, good morning, everybody. I am in the sauna here. That's why it looks weird. So I wanted to talk about pain today. Most everybody comes into the office with pain. Well, let me explain this and contrast a little bit. The first thing is pain. Uh, the way the medical doctor views it and the way we view it as chiropractors. So if you go to a medical doctor with pain, they will use pain as part of the diagnosis process. If you go in there with a knee pain or an ankle pain or a gallbladder pain, that is going to be part of their diagnosis. So what they'll do is they'll look for that. Now they'll give you something that will block the nerve signal that's carrying that nerve information there of pain to the brain to be interpreted as pain, and therefore, making you very uncomfortable. So that's the way medicine deals with it. It's more of just trying to block it. When you go to a chiropractor, pain is not part of the diagnosis. We realize that pain is actually a function of the body, a warning function of the body, that there is an immediate or a long-term danger if you don't change your behaviors. So, for instance, if you touch a hot stove, that is an immediate function of the system to let you know that something is wrong immediately. And that's why people respond to this so quickly. It's a reflex. When you have pain more long-term, it's also letting you know that if you don't change your behaviors somehow, there is going to be a long-term, life-threatening consequence. That's what pain is there for. So a chiropractor doesn't do anything to block it out. Now, so we look at pain as something very good, as a warning system. Now, how do we treat these things? When people talk about this, I'll often say, well, what's more important, that we remove the pain or we remove what's causing the pain? That's where chiropractic comes in, where medicine will just do something to block the nerve signal saying that there is pain present. Chiropractors look for the cause to remove that, because even if you just block the pain, the reason it's still there is the problem. That is the cause. So what we're concerned with is removing the cause of that. Now, medicine can do this very quickly. Chemically is one of the quickest ways to do it. I mean, people use heroin because it takes away all the pain, not only physical, but mental too. But there's tremendous consequences for that. So that's the way we look at pain. Now, I want to talk about something different here. Pain versus suffering. Suffering's a bit different. Suffering, where pain is purely physiological, suffering is a psychological thing. And we can see this, for instance, dogs. Dogs do not suffer. Their consciousness does not allow them to suffer. They really don't have that. So where a person, if we, stub our toe, not only will we fall over, buckling over in pain, but we'll milk it for a little bit, letting everybody know, hey, we hurt ourselves, and this is a way possibly even to manipulate for a little sympathy. Very different from a dog. What happens with a dog? They stub their toe, they yelp a couple times, and then they're right out again. They don't suffer. They use pain as a physiologic mechanism to let them know, hey, I did something wrong, and I shouldn't be doing that again, or I need to give my body some time to heal. So pain and suffering are a little bit different. Medicine, is really what they're doing is just trying to treat suffering. And that's why they just cover everything up. And there may be a time and place for that. Look, if you're going to get if you're not taking care of your teeth, or for whatever reason you got to get a tooth pulled, I'm very thankful to have that medication in there, because I really don't want to experience that. But understand, it's doing nothing for the cause. There is actually a disease called, I think, for congenital insensitivity to pain or something like that. And I will put a video link for this, but if you will see this with little children, this is horrible. As they're teething, they bite their hands. They don't even know it, so they're biting up their hands. They gouge their eyes out. This one girl, I was watching a story of a little baby girl. She was scratching her eye so hard she had to get her eye removed. She was a little baby. It was really, really sad. that you have pain, that means your body is working. It's letting you know something's wrong. So we're going to figure out the cause in chiropractic. Now, there are certain things you can do that won't be so damaging to the body, like putting a little bit of ice on it during your time of healing. But understand that's a very, very necessary part of your body's physiology to let you know it's a warning signal, to let you know something's going on. So give your body a little bit of grace. It's trying to function properly. Please don't try to cover things up with it, because there will be long-term consequences for that. All right, I hope that makes sense. I love and appreciate you guys.